think about the term beneficiary voice, a lot of things come to mind. But what it means to us is really the people whose lives are impacted by the decisions that we make. They help us to understand what the nonprofits are up against, their challenges, their opportunities, and they help us to become the kind of grant maker who really works in partnership with them. When we listen, we get much closer to an answer that's going to make a difference.
Once the people that you serve really see that you're using that information and that there's a relationship and there's a two-way street and there's a back and forth, it doesn't really become something you have to do. It becomes a place of where you are because you've taken information from the people that you're serving and you've used it to make a better product. A great example of how beneficiary voice is used in a program at Neighborhood Family Practice is their Centering Pregnancy program.
With centering and with the group prenatal care, there's the medical care, the education, and then the support. It's a bunch of women and their support people and the two co-facilitators. Our groups really do reach a level of authenticity because we do listen, because we value our moms' voices and what they're saying.
We kind of make sure that the conversation keeps flowing, but it's the moms that are taking the conversation where it needs to go. They're the ones that are asking questions and giving answers and sharing their experiences. I'm looking at what they know and what they don't know. Things like it's okay to take an ambulance to the hospital, which most people think that, yeah, that's okay, but the ambulance isn't going to take them to the hospital that they choose. Those are topics that I want to make sure that we cover during centering. And our responsibility is to make sure that they're leaving with the correct information. They are the ones that are becoming responsible for their health care because we have them take their own weight and their own blood pressure, and they're recording all of that information in their own books.
They feel more in control and more vested in the process of their pregnancy. And with that, it gives them more confidence, more self-esteem.
We always make sure that we're asking them, what do you want to know about? What they want more of? What can make this better? What were things that you really liked about the program that, we may not have done in other groups? And we talk as a team as well as to what's working and what's not. We really try and listen to our patients, and by having those relationships that we have with them, it makes it easier for them to tell us what they want and what they need.
One of the things that we've learned through listening in a systematic way to our grantees is that when we decline a grant, the organizations wanted more information. They wanted clarification. They wanted to know if a no this time means a no every time. And so what we try to do in a very intentional way is provide opportunities to provide feedback, and feedback that will help the grantee the next time.
A lot of the work that I do in the community is really just listening to what the community has to say about how they want to live, how they want to connect, the things that they believe that they're able to do, and how they can infuse their voice into some of the political processes or how other community-based organizations are thinking about what needs to be done in the neighborhoods in which they live. One good example of the way communities come together to implement a shared vision is the Buckeye Larchmere Woodland Hills Healthy Eating Active Living Initiative.
Healthy eating and active living is all about creating opportunities to live healthy that are developed for community by community members. We came up with a plan that would engage all types of people in the community, young people, our seniors, our families, individuals, and allow them to connect to opportunities to live healthy in the neighborhood.
Engagement for us is equally successful if it results in a resident planting a garden for the first time, or if it results in a group of residents who are already walking and helping their own health, getting together and forming alliances. It's also bringing new institutional stakeholders into a conversation that also is fueled by resident input, by consumer input, by healthcare provider input. If you truly want to build capacity, then you have to engage all of the levels that are significant, particularly when it comes to neighborhood building. Because when we connect with each other around something that we have in common, and healthy, successful, vibrant, vital living at age 6 or age 96 is something that we all have in common, boom, that's success.
We also engage some grantees on our board, and we understand that creates conflict. However, it's a conflict that we believe is manageable, and we manage it carefully because we believe that the benefit that we derive by getting as close as we possibly can will help us to be the most effective grant maker that we can possibly be.
So it's important to be really open to hearing kind of what the family's perspective is on what their needs, their wants and their dreams are. And the reality is, if you don't start where that family is, you won't be as effective. One organization that pops to mind immediately that does a really good job of building beneficiary voice into everything that they do is Legal Aid Society.
At the Legal Aid Society of Cleveland, we incorporate the beneficiary voice in a number of ways. First, we have board leaders who are eligible for our services. They're low-income people. Second, we have a managing attorney for community engagement, and it's her job to connect with the community. Third, we use data, internal and external data.
In general, my job is to make sure that we are in a dialogue with our client communities that is two-way. So we hear what they're saying in addition to providing services back to them that they say they need. That we are not just running ahead with litigation or pursuing an advocacy agenda that meets our needs, but have you really considered the perspective of the clients in this situation? While we have long published a newsletter called The Alert, it previously focused only on issues related to seniors. We recently expanded that to make it more effective in response to beneficiary voice. And in the course of this year, we have seen the number of subscriptions increase and receive positive feedback.
Beneficiary voice is really important to incorporate in the institution. You have to focus your board and your staff and your supporters on making sure that beneficiary voice is truly part of the organization. But I feel like if we take our eye off the ball, we will lose that opportunity to really incorporate beneficiary voice, which makes us so much stronger.
Looking ahead to being back in the neighborhood of St. Luke's is really exciting to us. It will give us an opportunity to become part of the revitalization that we care about. Because for us, feedback is a driving force to know what's working and what isn't as we work toward best practices to provide leadership and support for the improvement and transformation of the health and well-being of individuals, families, and communities in Greater Cleveland.